My name is Dr. Bernie Bulcourf. I am a clinical psychologist with SIMEDHealth Psychology in Ocala, Florida. It's important to realize that pain is a necessary part of the human condition. It allows us to respond to a stimulus that is causing emotional distress and subsequently impairments in functioning in our lives. When we don't feel that we have a sense of control over that level of pain or the level of functional impairment, we start to have negative emotional reactions to that, and that can subsequently lead to further disability and dysfunction in our lives. Some common psychological challenges that individuals face is a catastrophic response to their pain, in which they ruminate solely about the pain and that level of dysfunction. The avoidance behaviors, in which they don't want to engage in any type of physical activity which they believe is going to cause a worsening of the pain. It's also important to get them to accept their level of pain and how much dysfunction they're actually having, so they can better analyze that for themselves. And the fourth is going to be the relationship between a past history, a potential history of abuse, and their current pain condition. So cognitive behavioral therapy is nothing more than looking at an individual's thoughts, emotions, and behaviors and how they interrelate to each other. So you get an individual to look at how they're thinking about their pain, how they're behaving towards that pain, and then their emotional response to that, and try to find more better coping strategies to help them deal with an error in thinking or an avoidant type of a behavior. The meditative approach to mindfulness, looking at an individual's how they're responding to the pain and pain dysfunction, and trying to come up with a better strategy, a mental strategy that they can accept that pain condition. There are multiple psychological approaches to managing chronic pain as well as emotional dysfunction. Meditation is one of those, where you can learn a lot of different meditative techniques. There's biofeedback. There's also self-hypnosis that can be learned. Activities, pacing, and journaling can also be very helpful.